It's World Heart Day today, and it's very important for all people to be aware of heart valve disease, its prevalence, and even for consumers to be advocating for their health and trying to listen to their hearts. Heart valve disease is when one or more of the 4 valves within the heart are damaged. It is really important because the valves within the heart are responsible for blood flow in and out of the heart or within the heart itself. Nearly 30 million people in the world are affected by heart valve disease.
There's around 500,000 patients with diagnosed heart valve disease in Australia and around another 250,000 patients that have undiagnosed heart valve problems. And they're the patients that are most at risk because they're the ones that may develop heart failure or other complications of heart valve disease. The major causes of heart valve disease include defects that people may be born with, where the valve is abnormally formed. I mean, it can leak or narrow early in life or have early onset disease in later life. People can get infections on their heart valves. There can be processes such as rheumatic heart disease from rheumatic fever, which is a big problem with Indigenous Australians. And most commonly, calcification of the valves means that they actually narrow.
There's significant breathlessness, fatigue, dizziness, palpitations as well, that really do have an impact on one's day-to-day life. Symptoms can obviously range from mild, moderate to severe. The mild forms of these type of symptoms, when you think about fatigue and perhaps lightheadedness, and can actually sometimes be put down to aging. And so we maybe miss the signs and symptoms until they actually present with far more serious signs later down the track.
There can also be abnormal heart rhythms that can be associated with heart valve disease, and less commonly patients can get angina, as they would with coronary artery disease, where you get that tightness in the chest associated with the strain that's being put on the heart because of the underlying valvular disease. Heart valve disease can impact a patient's quality of life, mostly around the shortness of breath or the fatigue or tiredness that patients get when they have significant heart valve disease that may or may not be affecting their heart function at that time. As it progresses and you have heart failure or damage to the heart muscle, then those symptoms become worse.
We know that people are more likely to be hospitalised as well as a result of living with heart valve disease, and it's quite important to track these symptoms very early.
Early detection of heart valve disease allows patients to have the problem managed and preserve their heart function much earlier before they often get symptoms or have impact upon their quality of life.
Being diagnosed with heart valve disease is definitely not the end of the road. It is a turning point to a better life. Thanks to modern day treatments and therapies, people now, once appropriately diagnosed with heart valve disease, can get the best treatment that they can and can live a rewarding life. The common treatment options currently for heart valve disease are medications. We have surgical options as well, along with minimally invasive procedures to either repair or actually replace the valve.
There are now a number of new minimally invasive techniques available. Transcatheter options, which actually open the ability to treat more patients with heart valve disease where surgery may be limited. The key barriers to care for people with heart valve disease is actually early diagnosis. Patients needing to see their GP, have a heart health check done, where something as simple as hearing a heart murmur may actually allow the diagnosis at a stage before patients have even the early onset of symptoms.
Today for World Heart Day, the theme, a new beat, a new beginning, is really important for us here at Heart Support Australia. A new beat implies early detection. We know if you go in early to your GP or even your cardiologist, listening to your heart can be a difference.
World Heart Day is about patients taking the opportunity to speak to their GP, have a conversation and an examination on their heart, see if there is any underlying problems that mean that they can actually receive management earlier before heart failure and heart muscle damage might affect them for the rest of their life.
A new beginning is really important because once we actually able to have a diagnosis of heart valve disease, thanks to modern day medicines and therapies, you may be able to live a fulfilling life.
Early diagnosis is a new beginning because that's an opportunity to receive early treatment and make sure that your heart is as healthy as it can be, and therefore you're as healthy as you can be, and live life as long and as full as possible.